Dr. Mathur, welcome.
Hi.
We're so excited to have you here at Viva Eve and on the podcast. For those who haven't met you yet, can you tell us a little bit about your background and what drew you to OBGYN?
Yeah, so thank you for the kind welcome. I'm so excited to be here. I grew up mostly in California. I went to medical school at the University of Toledo in Ohio and then did my residency on Staten Island. Moved back home to California to be closer to my parents for a couple of years. But my heart's always been in New York, so now I'm back.
That's awesome. You are our newest OBGYN. What inspired you to join Viva Eve and what excites you most about caring for patients here?
Yeah, that's a great question. So I think one of the things that drew me to Viva Eve was how patient-centered the care is. When I walk into an exam room, and not even an exam room, I walk off the elevator and everything about Viva Eve is about making your visit to a provider the smoothest it can be. You have all the information right there at your fingertips. You can ask any questions that you have, and there's always someone who's kind of a specialist or knows exactly what you need to ask. Questions about finances. Does my insurance cover this? And then once you get in the room with a provider, then you have all of the tools right there in the room with you, whether it's an ultrasound or you're drawing something on the tablet. Being able to educate patients in a way that makes them feel comfortable, makes sure that they're really understanding what we're saying, and being able to visualize it in a very realistic way.
Love that. Very well said. Patients don't always have that experience.
Yeah, they really don't. And it's so incredibly important.
Let's talk about women in their 30s. What should this age group be focused on in terms of their reproductive health?
I think your 30s are a really important transition point in your life. A lot of women are waiting a little bit longer to start a family. They're more focused on their career. So I think at that point in any woman's life, the most important thing to do is make sure that you have taken care of yourself. You are working out consistently. You have a diet you feel comfortable with, hydrating really well. It's the small lifestyle modification things like diet and exercise, managing stress, journaling, whatever it looks like to you. The self-care portion of it, that's probably the most important because it will impact every future decade of your life, every other phase of your life. So it's always better to have that kind of figured out and in a routine that feels comfortable sooner rather than later.
If a woman is in her 30s and she's actively decided she's ready to begin trying, what does she change right away?
Not a ton. And this is where the individualized medicine really comes in because it depends. If you have someone who's perfectly healthy, no other medical problems, she's having regular menstrual cycles and not having any problems with her menses, most of the time you don't really need any testing. You can just start trying.
Got it.
But if there's other things that kind of complicate the picture, for example, high blood pressure, diabetes, your menstrual cycles are irregular, then that's a conversation, that should be had with a provider because then we can tailor your lifestyle modifications, medications if we need them to what is going to fit your personal experience, your lifestyle. And that's where I think Viva Eve really makes the difference.
Beautifully answered. Perimenopause is a topic that doesn't always get the attention that it deserves. What kind of changes should a woman in her 40s be looking out for?
Yeah, that is an excellent question. I totally agree. A lot of women don't know what to expect. Part of the problem there is that, again, it varies significantly. You're kind of on a little bit of a scale on how affected you can be by perimenopausal symptoms. You have the classic symptoms that kind of most women know about: hot flashes, night sweats, mood swings. But it can also be more subtle. It can be difficulty concentrating, having a harder time with weight management, finding that what used to work for you in your 20s and your 30s in terms of self-care has now shifted a little bit. Maybe you're noticing changes in your body where you're feeling your knees are feeling a little bit weaker, your joints are having a little bit more inflammation and stress. So it can be anything from very subtle to full-blown hot flashes, night sweats kind of thing. And every woman experiences it differently. So I think the best thing to do is just have a conversation with a provider and have it early so that you know kind of what to expect. You can start to keep track. You can change your lifestyle, your self-care to sort of fit what you're going through in that phase of life.
A lot of people just don't know to pay that much attention, especially when it's not sort of like those buzzwords. Very interesting. What advice do you have for women who hesitate to advocate for themselves in the exam room?
Don't hesitate. Your time with your provider is special, and it's yours and yours alone. How you experience healthcare is going to change depending on how comfortable you are speaking up for yourself. And you don't have to be, very loud or aggressive about it, but you do need to just say, hey, I feel more comfortable if we do A, B, and C versus what you were trying to do. And I would say that most providers are going to be willing and ready to make small changes to make their patients feel more comfortable, right? It's easier for me to do my job if my patient is feeling comfortable, if we're communicating honestly, and if I can understand what she needs in that moment.
Love that. That's the exact philosophy of Viva Eve, is partnering with the patient and not just having one voice in the room. And if there's one thing you want viewers to take away from today, what would it be?
I would say that the most important thing, whether it's women's health or just healthcare in general, is educate yourself. Talk to your provider. Take the time to ask questions. Anything that feels confusing. There's so much information out there, and it's right at our fingertips. But you have to have that trusting relationship with your doctor to kind of figure out what's real, what's not real. So help them advocate for you. Ask questions that you feel are necessary for you to make good decisions about your healthcare. Everybody's path is different, and doctors understand that. We just want to make sure that we're doing what we need to get you on the right track.
I want to thank you for joining us today.
Yeah, my pleasure. This was a lot of fun.